replacement is required. One method to restore function is with a complete removable denture. On the top arch, a denture covers everything, including the palate, using suction as a means of retention. On the bottom arch, there is less overall surface area on which to rest the lower denture. As a result of there being less to hold the denture in place, the lower complete denture is not always the most comfortable and tends to move around more so than the upper. One way to improve the comfort and function of a loose denture is to fix it in place using implants for stability. Generally, as few as 4 implants may be used to screw the denture in place by the dentist. Only the dentist can remove the denture. This solution offers the advantage of having teeth that are fixed in place. The additional benefit of not having to have the roof of the mouth covered by the denture, because it can now be held in place by the implants, improves both taste sensation and the overall feeling of having your own teeth on the upper arch.